Well, as we reported earlier, the CDC announced this afternoon it is easing masking recommendations for 70% of the country, including inside schools. And joining us now with more on the decision and the latest on the pandemic is Dr. Harish Moorjani, who specializes in infectious diseases at Phelps Hospital Northwell Health in Tarrytown. Doctor, thank you so much for joining us. What do you think of the CDC's decision today?
Good afternoon, David. Yes, so it's about time that we started rolling back mandates. Mandates, as we know, are there for public health emergency purposes. And once that public health emergency is sort of coming back down, and we are in the closing stages of at least this wave of the Omicron COVID-19 variant, I think it's time to roll back the mandates. But that doesn't absolve individuals from protecting themselves and taking on responsibility for their health if they feel comfortable. So wearing masks at an individual level is highly encouraged, as is COVID appropriate behavior. The pandemic has not come to a close yet, and I think we need to continue to observe COVID appropriate behavior as is appropriate for an individual level.
You know, on that topic, the CDC is changing its metrics for guidance by putting less of an emphasis on case counts and giving more weight to hospitalizations as a key measure of risk. So is that a good model to follow?
Absolutely. I think taking a holistic approach of the whole community and local communities and the whole state, the whole county, whole nation as a whole is what we need to do. Instead of taking a precise approach of case counts, which may not mean much because the case counts may be all out of the hospitals. It's the hospitals that provide care for an inpatient, acutely ill person that is very important in this situation. We don't want the healthcare system to collapse. We do not want the healthcare system not to provide the routine care that they provide. So I think rolling back those mandates is absolutely appropriate at this time, and taking a holistic approach of the whole pandemic in the community and then intervening based on those is absolutely appropriate.
Having said that, it's important to note that the country is still averaging about 76,000 new cases per day, but that's about a 66% drop from 2 weeks ago. So are we at the point of saying the pandemic is over, or at least the beginning of the end?
The pandemic is by no means over. And I think what we are seeing is the current Omicron wave coming down, and that has to do with the vaccinations, that has to do with herd immunity from a combination of vaccinations and natural infections. So whether this will then completely die down and become an endemic, or will there be a brand new variant that will come out and create another wave, only time will tell. But I think the more we vaccinate people who have not been vaccinated, the better off we are, because the current wave clearly showed us that this pandemic currently is by and large of the unvaccinated people.
That answer leads me to my last question. Last year, the CDC was sharply criticized for lifting mask restrictions too soon, only to have the Delta variant of the virus surge throughout the nation. So are there any variants on the horizon that concern you of that happening again?
So variants for COVID-19 will continue to emerge. Whether they will create another wave or whether they will create an endemic situation remains to be seen. I'm hopeful that I think given the herd immunity that is starting to develop with a combination of natural infections and immunizations, that we will not see another spike. What we will see is an endemic nature of the disease. And I think the endemic nature of the disease we can easily handle, because we have the tools, we have the antiviral drugs, we have the monoclonal antibodies, we have preventive tools now. And I think with COVID appropriate behavior, we should be seeing this pandemic come to a close and become an endemic disease.
Well, lots of great information in this interview. Dr. Harish Moorjani, thank you so much for joining us. And if you at home have questions weighing on your mind, submit them at ABC7NY, and we'll try to answer as many as we can right here on our air.